Hi, my name is Dr. Kevin Freedman. I'm an orthopedic surgeon. I specialize in sports medicine, which predominantly involves injuries to the knee and shoulder, as well as other athletic-related injuries. There's two different types of injuries to the cartilage in the knee. There's injuries to the articular cartilage, which is the cartilage surface, and then in addition, there's injury to the meniscus cartilage, which is the cartilage ring. When we see these injuries, sometimes they're damaged and have to be restored to be able to return normal function back to the knee. When there's damage to the cartilage surface, there's several techniques to try and restore that area back towards normal. One of the most common techniques that I use is to take a small piece of cartilage out of the knee. We send it up to Boston to grow the cells in the lab, and then we replace that cartilage by injecting it under a small patch to help that to grow back into normal cartilage to repair the area. In addition, when somebody's had a previous meniscus surgery and had their meniscus removed, we can do a meniscus transplant, which is an operation to place back in a cadaver meniscus in the area where the meniscus is missing so that that will restore normal meniscus function. There are some additional operations which I do as well to try and restore the cartilage to either the meniscus or the cartilage surface throughout the knee. Most patients with cartilage damage in the knee experience either pain or swelling. Sometimes in addition they can have instability or a sense of buckling in the knee. Many of the patients who come to see me for cartilage restoration surgery have had prior surgery on either the meniscus cartilage or to the cartilage surface and are looking for additional options to try and restore that cartilage back towards normal. An ideal candidate for surgery is someone who has an isolated area of cartilage damage in the knee. Many times I'm asked if there's an age category. Although certainly younger patients more commonly have isolated areas of damage, there's no real limitation on age. It has more to do with how much damage there is. When someone has significant advanced arthritis in the knee, many times it's too far gone to undergo cartilage restoration surgery, and the surgery is much less likely to be successful. Many of the techniques for cartilage restoration have been shown to have very durable results. And one of the great things about these surgeries is that the data shows that if we're able to restore function back towards normal at 2 years, many times that lasts 14 years or more. So the hope is that by doing these types of surgeries, we're preventing the need for future surgeries such as knee replacement. Some of these surgeries can be done as an outpatient, and certain patients stay overnight for 1 day in the hospital. Then typically we start physical therapy immediately after surgery to work on range of motion and strength. Many patients also get what's called a CPM, which is a motion machine to try and stimulate healing of the cartilage. Typically for about 6 weeks, weight bearing is protected on crutches. Then we advance through weight bearing as well as strengthening. By 3 months, people are doing most activities, but it can take 6 months or even a year to be able to return back to full activities, including impact in sports.